Hello everybody, this is Kylie again, Enoch's mom. I wanted to talk about a complication that he had. From birth, Enoch was in and out of the hospital for different complications of sickle cell disease, fever, pain, acute chest that I mentioned earlier in the first video. Every time he had to go in the hospital, though, for a crisis, from just a few months of age, he had to get a blood transfusion in order to bring him out of the crisis. Every time. When he was about 5, he ended up having to go in the hospital for fever and pain. And this particular time, the doctors were trying a new protocol. They wanted to stop giving the blood transfusions if the hemoglobin was not below a certain number, because they were worried about it being enough blood for them when they got older. And I went back and forth with the doctors at the time, because this wasn't normal protocol for Enoch. So we didn't receive the blood transfusion. We ended up going home on pain meds, but he was stable. Just a couple of days later, we ended up returning to the hospital because he was in so much pain, fever, he ended up having acute chest, a priapism, and 83% of his blood had sickle. So because he didn't get that blood transfusion, he got a lot worse. He had to get a corporal irrigation. He had to get a complete blood transfusion. And he had to receive therapy for the acute chest, breathing treatments. But he had to go in the surgery. He ended up having to go under to get all this done, because they had to get it done quickly. Later, after doing a TCD and an MRI on the brain, they also found out during that time he had a mini stroke. That was one of the worst hospitalizations that he went through, and that was at the age of 5.